That's their way out. So what you'll notice is if you have a child with big bills, that they may forget to send you the reminder notice. So you got to be careful. Now, in the United States, we have Medicaid. Medicaid is for people who earn less than a certain amount of money. And in this country, I can't remember the percentage of people who qualify. But you got to be earning a low amount of money to qualify or have a lot of kids. Now, if you don't meet the criteria to get Medicaid, there are insurances called Children with Special Needs. And so often hyperinsulinism children will fit that criteria. So it has to be a dangerous disease. So you can't say I've got hypothyroidism and I'm going to be spending $4 a month on prescriptions and I need free healthcare insurance. You're not going to get it for that. But if you have a dangerous disease, and this is a very dangerous disease as you all know, it is life-threatening. It has consequences if they don't have insurance. So if they don't have insurance and they don't get treatment, they can get damaged. And so then you have a badly damaged child. So in those circumstances, you can apply for Children with Special Needs insurance. However, it's very hard to get, takes a long time, but you have to do your best. The other thing to remember is that if for example, let's say that, I don't know what the cutoff point is, so I'm just making numbers, but let's say that you need to earn $30,000 a year or less to qualify for Medicaid. That's probably in New York. Down here it's probably lower. And let's say that you have a baby who has diffuse disease, gets admitted to the hospital, spends 6 weeks in the hospital, has surgery and goes home. That bill is going to cost you approximately $250,000 to $350,000, and you're not going to be able to pay it. So what happens is they do what they call a spend down. You apply for Medicaid, it's denied because you earn more than $30,000 a year, and then you say, well, I had $300,000 in healthcare bills, so now your cost exceeds the cost for Medicaid, so you get retroactive Medicaid, and then you don't have to pay the $350,000 to the hospital. So there are a lot of things to do. So the most important thing to take out of this is, even I don't understand the system fully, and I can't keep track of it. So when you come and you see your doctors, and you have a child with hyperinsulinism, you need to meet with your social worker, and you tell them, we're struggling with the bills, we can't get healthcare insurance, and they will do everything that they can. So all of us are used to dealing with families who have problems financially, and we have people, financial counselors, social workers, everyone is in place to help. So nobody should ever not speak up and say, I'm having a trouble with this, I need help, because there are lots of things that can be done to help. Yes, ma'am.
Okay, we have a mom that she can't afford the medicine at all. Is there any services out there, because they don't have insurance, they don't qualify for certain things? Is there any services out there that helps these families purchase the medicine they can't afford?
Right, so the question is, if a family has no health care insurance, can't afford the co-pays or to buy the medicine up front, what can happen? Well, the good news is that almost every drug company has got programs for people who can't afford their medicines. But they cannot offer them to you directly, because that would be seen as an inducement to make you use their medicine, or tell me to tell you, and then that's an inducement for me to prescribe their medicine. So a family has to call the drug company and say, I cannot afford my prescriptions. Once they do that, almost all drug companies have systems in place to help pay for medicine. Not only that, but there are organizations. So for example, in children, the Magic Foundation, which is really good at helping kids with chronic illnesses who have pituitary problems and growth hormone deficiency, they have funding that can help with that. Lots of drug companies have got programs that if you earn less than $100,000 a year, they can help you with your medicine. If you earn more than $100,000 but you still can't afford it, they can help you with part of it. So there are lots of things out there. And so what is most important is to know these things and to call your company. So for example, Angela, that's something that your website could do, is you could work with the social worker and say, talk to me about what advice could we give families who can or can't afford their medicine, and is there a little handout that we could develop? So that would be something
I would like that.
your website could do. You could work with a social worker and understand all the different things and say, you know, guidelines for those people who are having trouble affording their medicines.
Because we posted, is this the same thing? Remember the links I posted to, is it Teva and the other pharmaceutical companies in the private group? Those are the assistant forms that I found online,
They're called
right?
patient assistance
Yes,
programs.
that's what okay. We need to really have her do that.
Yeah.
Yeah.
So what you can do is you could put an article up on the website that says, you know, what to do if you can't afford your medicine.
I will.
And then you can explain the ins and outs of it. You could work with the social worker. My social worker, Adam, would be very happy to work with you after I tell him to be happy.
Okay.
And you know,
I won't give him a hard
we could give you some help you, and then you guys who've had experience in going through it could do it. You can contact the pharmaceutical companies. For example, Sandoz makes octreotide, Gate Pharmaceuticals makes diazoxide. You know, you can call them and ask them what are their patient assistance programs, and ask their permission to put information on your website. And this is the thing that family support groups do the best.
Can I add to that formula companies are the same way? We don't receive Medicaid for our child who are over income, but for 4 years we've never bought formula for him, and it's approximately $1,200 per month. And we just had to apply as a family. We're on the state employee health plan in South Dakota, and it's considered optional to feed your child in the state of South Dakota, so they will not pay for specialty formulas. And he's on a special formula for children's malabsorption, and we've never paid for formula.
You know what? I'd like to introduce you to Kenesha because I think that we need to reach out to her sincerely.
Every formula company
she
has
can't.
a program to pay for it. It's not like I'm buying Enfamil over the counter. I mean, it's like $170 a box for Neotate Flash. The box was, I don't know how many years, they're like 27 little containers. They pay for it every month. They ship it to us, and every 6 months his endocrinologist has to sign off that he has a medical need to be tube fed, and that's all we have to do.
So for those of you listening online, we've just had a discussion that reminds us that the infant formula companies, especially those companies who make the specialized formulas for people with digestive problems and problems absorbing food, will also have patient assistance programs. So, like I mentioned, you know, one of the things that family support groups do best is they deal with some of the things that doctors don't do best. And so, you know, in a hyperinsulinism team like mine, where we have a social worker and a psychologist and we can help you with all of these things, and we've seen a lot of patients, there are a lot of things that we can do. Whereas if you're seeing an endocrinologist who sees one of these kids every 5 years, they may not know of all of the little things available. So as a family support group, having a help sheet up on your website would be wonderful.
Yes, because the one that we have.
It's complicated too per state.
It's different in every
Well,
state.
I have one where it had 50 states health state. I had a deal where it had all 50 states, but it doesn't have pharmaceutical companies or the things that.
Right, but what you could do is you could find out what's the patient assistance number and post it for Gate and post it for Sandoz.
I did that in our Facebook, but I should do that. I didn't think about our website. We have 150 people in our little
Now,
group.
the other good thing is that although everybody complains about Medicaid in this country, if you have Medicaid and you have doctors who will see you, it is the best insurance you could possibly have, because there are almost no co-pays. It's really tiny. It's really good. The problem with Medicaid is a lot of physicians don't see Medicaid patients. However, in pediatrics, almost all hospital-based pediatric endocrinologists see Medicaid. And so, you know, if you're seeing a private practice endocrinologist and you've got hyperinsulinism, typically they'd rather you see an academic center. And this is another reason why. It's for the insurance. So.
Are there any facilities for HI adults to go to? Because one lady had a problem because it was a children's hospital.
So the question is there any adult facilities for people with hyperinsulinism? And the answer is yes and no. If you said, are there any facilities that do excellent research and work on adults with hyperinsulinism, the answer is yes. The Mayo Clinic would be the #1 place in the country for adults with hyperinsulinism. Primarily because they originally did all the work with insulinomas, which are the tumors that cause insulin secretion, which is a far more common cause of hyperinsulinism in adults than are the genetic forms. However, they also have done a lot of work with some of the genetic forms, and they're a little behind the pediatricians in terms of the knowledge on the genetic forms and how to evaluate and work up hypoglycemia, because this is really a pediatric disease. But the Mayo Clinic is the #1 place.
Okay.
You know,